At Chestify, we are using artificial intelligence and machine learning to transform patients' healthcare. Did you know that in the US, they have one radiologist for every 300 people, but in Ghana, we just have one radiologist for every 450,000 people. In other African countries like Kenya, over 1 million people are serviced by one radiologist. On average, it takes a radiologist nearly an hour to review the images and write a report from a single patient. This means a massive backlog for patients who must wait days or weeks to get a diagnosis. For emergency patients, these delays are sometimes fatal. We looked at this and said, why isn't there a better system in place? At Chestify AI, we provide much-needed diagnostic healthcare to patients in developing countries. We do this by connecting healthcare facilities on our system to collect CT scans, X-rays, MRI, mammogram, and pathology reports. Our AI-enabled DICOM viewer can instantly access the images and write a draft medical report of the condition of the patient. We then have a network of specialized radiologists who will review and edit the reports to ensure complete accuracy. This final report is then sent back to the facility. From there, the doctor can discuss the results with the patient. Chestify AI reduces the time and cost to a price point that every local healthcare facility can afford. We generate revenue of medical images reported by our radiologists. On average, a radiologist can complete 5 reports in an hour and will earn $16 for each report. This is almost 4x what they make without Chestify AI. We keep 25% of the fee as our revenue. During the ASIP accelerator, we pivoted our model and currently have 2 diagnostic centers signed on as customers. We already processing 250 images per week. We already have monthly recurring revenue of $18,000 and are projected to reach $120,000 monthly recurring revenue by first quarter of 2024. The global teleradiology market size was valued at $2.17 billion in 2021 and is anticipated to expand at a compound annual growth rate of 12.5% from 2022 to 2030, especially in Africa. We are rapidly expanding through key partnerships. First, we are finalizing a partnership with Checkup Labs in Kenya to report their medical images. They currently process more than 6,000 medical images per month, and we would be reducing their turnaround time by 80%. Starting in January of 2023, we have been part of the UNICEF Startup Lab. We are excited to announce that on June 25th, we will start deploying Chestify into dozens of UNICEF partner hospitals across rural Ghana. Our agile team of 6 has a combined experience of 15 years in business development, artificial intelligence, software engineering, radiology, healthcare, and operations. Leading the team as founder and CEO is myself, Mustapha Zaidan, with 10 years experience in engineering. Join Chestify as we raise $250,000 pre-seed funding to solidify our products, grow our user base to 1,200 healthcare facilities and scale across 3 African countries, Kenya, Liberia, and Nigeria by the end of 2024. Thank you.